think about this patient a lot still. I had a patient in a very underserved community. Um, she had a minority background. She was still working well into her early 70s, working regularly. And she was, matriarch for her household. She was she was helping support her children and grandchildren. She had a really independent, successful career, but she had a lot of accumulating risk factors. And it was a real challenge because she had to commit so much of her life and time to her family and to her work, which was very important for her family still, that she was letting these really important risk factors slip. She had really advanced diabetes that had been unmanaged for a long time. Her kidney function was starting really to progressively fail. And, it was one of those stories where every time I saw her, we sat down and we had a heart to heart that, we're moving in the wrong direction, and we got to figure out how to get you, some more healthcare help to get control of these major comorbidities. And she developed a wound on her toe, which we kind of knew was coming.
Mhm.
We revascularized her. 6 months later, the wound reappeared after it healed. We revascularized her again. And it became this cycle just of, a little bit of just, watching a close family or friends kind of pathway kind of slip away. Soon her kidney function failed enough that she had to go on dialysis. She had some heart failure symptoms. Yeah, I spent a lot of time with her family. I'd see her at least twice a month, if not more. And, in the end, we were able to save her limb. We were able to get a lot of her comorbidities under control. But, she still was just left with this, part of her life where she should be celebrating all the success of building a family and supporting a family, and is distracted by all these mounting healthcare concerns. And so, I think that the learning part of this was important to me because, we as physicians are, unfortunately, it's like, you go to a farm and you watch the chickens walk around, and it's hard to pay attention to individual chickens because there's just so many chickens coming through the door. Like, we just get stuck in this world that a patient is a 15-minute visit, and if needed, a phone call later. And this was one where you can tell that this patient could have benefited from some real dedicated healthcare specialists that branch all specialties, not just, an interventional cardiologist or vascular specialist, but herding other specialties together, communicating. It just showed you where our system continues to let us down. And so I think about that a lot, and a lot of the stuff that we've been working on recently. And I have guilt about the fact that we're really good at naming and pointing out problems, and we're not as good at actually offering solutions for those problems. And this patient always reminds me why we need to extend what we're doing to that next step, which is get into that patient's back, into their neighborhood and make a difference, not just, write a paper and publish it in a journal. And so anyways, I think about that patient a lot, and I think for me it was really good training in the social areas of medicine that we don't get enough background in medical school, and I appreciate you asking for me to share that.